Adenomyosis means the same tissue, endometrium, is now found within the layers of the uterus, which in medical parlance we call it myometrium. So whatever reaction and response it caused and created inside the substance of the ovary now happens within the wall of the uterus. Now such a collection makes the uterine muscle thickened. Okay. Uterus is nothing but a muscular bag, the inside lining of which is dynamic. Okay. So when the muscle of the uterus gets affected with the same problem, the elasticity of the muscle of the uterus starts getting affected negatively.
So what does this mean for the patients? A lot of pain, a lot of discomfort?
This means, yes, exactly. Endometriosis, you were very keen to understand the symptomatology of the endometriosis when you started this session. To answer this question, I would like to tell you that the most mildest form of endometriosis can give severe pain to the woman, and the severest endometriosis, which we call as frozen pelvis, can be absolutely painless.
Whoa.
So when the muscle of the uterus gets affected with the same problem, the elasticity of the muscle of the uterus. So pain is never an indicator of the severity of the disease.
This is new.
Okay. But any woman who has adenomyosis also, in addition to endometriosis, such a woman will suffer from severe uterine cramps, severe period cramps, and maybe heavier bleeding as well. Adenomyosis is also found normally in any woman who is in the late 30s or in early 40s. Okay, so any adenomyosis we encounter in our day-to-day clinical practice, we must also look for an associated endometriosis.
So connected.
Yes. In Hindi, we call it choli daman ka saath.
Choli daman ka saath. What does it mean? Actually, I don't understand too much of Hindi.
Okay, choli means the blouse.
Yeah.
Daman means the dupatta, the chunri. So if one is there, the other should be there.
Yes, yes, yes. Ah, right.
So pain is never an indicator of the severity of the disease.
This is new.
Okay. But any woman who has adenomyosis also.
You said something very interesting. You said the younger the patient, the more severe the case and the worse the prognosis.
Yes.
Isn't that
the worst prognosis is because endometriosis is something like termite which eats away the ovary. When it eats away the ovary, it also reduces the fertility potential of that woman. We call it ovarian reserve. Okay.
Yes.
So ovarian reserve means it is just talking about the number of the eggs left behind at any point in woman's life. So just like to explain it in a simpler terminology, bank accounts. How much money is there in our account? What do we have? We have either the statement or the passbook. Similarly, what is the fertility potential of a woman? How many eggs are left behind at any point in time? How do we know? There are a couple of tests. We call them as ovarian reserve testing. Have bank accounts? How much money is there in our account? So any woman who has endometriosis, our first concern is to see whether she has adequate ovarian reserve. Earlier in the life endometriosis starts, more severe it is by the time the girl reaches adulthood. By then the damage is usually significant.
Wow.
This is about the numbers. So any woman who has endometriosis, our first, now I would come to talk about the egg quality. Endometriosis also affects the egg quality negatively. So this is double whammy. Fewer eggs, okay, we understand. But fewer eggs with bad quality. You understand the situation. So that is why endometriosis is something which affects the fertility quite negatively in both the aspects, the ovary as well as the uterus if the uterus is also affected negatively. Now I would come to talk about the egg quality. Endometriosis, apart from this, any woman who has adenomyosis is at higher risk for implantation failure. Implantation failure means in IVF, even if I put a good, nice, beautiful, healthy embryo, which is chromosomally sound, the uterus may not be able to accept it. The process in which the uterus accepts the embryo is called implantation. In a uterus which has adenomyosis, implantation is hampered and hindered. Even if implantation happens, the chances of miscarriage are very high. Even if the pregnancy continues, the chances of premature delivery are very high.
Oh no.
Even if the pregnancy goes on gradually, there can be problems with placental location and implantation. Normally, at the time of delivery, once the baby comes out, the placenta also must come out on its own completely. In a woman with adenomyosis, such placentae may not come out on their own. They are stuck to the uterus abnormally.
What does this mean for the patient?
Bleeding at the time of delivery.
So when we hear cases about, mothers bleeding to death.
Postpartum, yes. Postpartum hemorrhage. That is why postpartum hemorrhage in elder mothers, any woman who is beyond a certain age. Earlier, it used to be 35. Now, between 35 and 40, childbearing is considered normal. Because these days, we start childbearing late. We get married late. Okay. Yes. We have our careers to settle. We take time to find a spouse. All these things are good things. But the reproduction takes a beating. Okay.
What does this mean for the patient?
Bleeding at the time of delivery.
So when we hear cases about,
can contribute to such issues.
This is one bad news after the other, and it's very scary.
Exactly.
That it's 40 to 45% of women affected.
Yes, this is what I have found in my clinical practice. There could be one reason. The center that I work at, it's a tertiary care center.
Okay.
So it is quite rare that I find simple cases. Okay.
Someone like you
can contribute to such issues.
This is one bad news.
So that is why I'm talking about my practice.
Yes.
If you take an average gynecological practice, the incidence may not be this high. Because in that kind of a clinical setting, mild cases, I assume, should be more commoner. Okay. So that is why adenomyosis, it affects starting from implantation to delivery. So that is why I'm talking about my practice.
Yes.
If you take an average, any woman who has adenomyosis during the early phase of life, eventually might have heavy bleeding during her perimenopausal life as well.
I know someone already.
Okay, so this is what adenomyosis can do. Endometriosis is not something that is limited to gynecology or only pelvis. Endometriosis can affect even our intestines. When two tissues get stuck abnormally to each other, one of the two tissues, one of the two organs can be indeed, in fact, the intestine also. Endometriosis is not something that is okay. So intestinal endometriosis is bad. There is another variant of endometriosis. We call it rectovaginal fascia endometriosis. Now, this kind of endometriosis, there are no cysts, but there are nodules. Now, these nodules are present in the tissue between the rectum and the vagina. There is another variant of endometriosis. We call it rectum is the passage through which the fecal matter exits our body. Okay. Now, if endometriotic nodules are present in the rectal area, it is going to give rise to painful passage of stools. It could lead to bleeding in stools at the time of periods.
Wow.
It could lead to spasm and stricture. Stricture means an abnormal narrowing of the lumen of intestine. Rectum is the passage through which the fecal matter exits our body. Okay.
Yes.
And this can be also a reason for constant irritation in the pelvis.
This is. Thank you so much, Dr. Ma.
My
Subhak
pleasure.
are indebted to you, and we wish you the best, and we look forward to meeting you next week.
Sure. Thank you.
It's an absolute pleasure. Okay. All right.
Sure.
Thank you so much, Dr. Ma. Subhak.